Joining us now is Ashley Macquarie. She is also a forensic nurse. Thanks for being with us, Ashley.
Thank you for having me.
Yes, of course. And you, the subject that you really focus on through SAFE is human trafficking, looking at the signs, the symptoms, also coming up with resources for people who need help. I think this is such a tough issue still. I remember being in the news. This was always sort of in the news. You saw documentaries about it. People still in this area in Maryland, in the Baltimore region, had a sense that it wasn't happening here when in fact it was, and I'm gathering still is. Is that right?
Yes, that's true.
So tell us about how you define human trafficking.
Sure. So a lot of myths are associated with human trafficking, such as a woman is kidnapped and held against her will. She's chained up. Maybe she is transported across some kind of border, maybe a state border or national border. Other myths include that human trafficking in the United States typically consists of foreign nationals. So maybe someone from overseas coming here to be forced into the sex industry. And human trafficking is not very black and white. And what we see in the movies and in television typically are not how we are actually seeing human trafficking victims here in the United States and in Maryland. So research shows that the majority of human trafficking victims know their trafficker. So these are not strangers that are kidnapping women off the streets. Also, the myth that only women and girls are trafficked is also false. So like Laura talked about with sexual assaults, this can happen to anyone. It can happen to men and women. And then another big myth is, again, the fact that one of the myths is that, I'm sorry, one of the myths is that, okay, moving on. So I'm sorry.
No, it's okay, Ashley. So it's kind of tough doing these interviews when I'm not there and we're over Skype, but I get it. So you talked a lot about the myths. Let's talk about what the realities are.
Sure.
So what are we seeing? And you can keep it, obviously you can't talk about people specifically, but you can talk about sort of trends in this area. And obviously they have to exist because otherwise your position wouldn't be there.
Exactly. So human trafficking is, there's different forms. There's labor trafficking and then there's sex trafficking. And for human trafficking, for labor trafficking, it has to be force, fraud, or coercion that is used to exploit a victim. And sex trafficking is the same. So force, fraud, or coercion must be present for adult victims. The difference with minors is for sex trafficking, any minor that is involved in commercial sex, regardless of trafficker involvement or whether or not the act is voluntary, they are considered a human trafficking victim. So any minor under the age of 18 that is involved in commercial sex, and that would be anything, any sexual act exchanged for something of value, money or something else of value.
And there's a whole host of other legal issues when it comes to minors too, I'm sure. But when it comes to adults, I would think there was a lot of gray area. I mean, you say it has to involve force or coercion, and I would imagine that the victim would often be somebody who's very vulnerable. So what kind of population are we talking about?
So there are a lot of risk factors that are associated with human trafficking. Traffickers will tend to target those with unmet needs or those that do have vulnerabilities. So when we think about that, we talk about younger populations. So, younger kids. And some studies show that traffickers are targeting children around 12 years old or a little bit older. Other vulnerabilities can include poverty, history of drug or alcohol abuse in the home, family dysfunction. It could also include things like history of running away, or any kind of sexual, physical, or emotional abuse in childhood is a big risk factor.
So a trafficker would be somebody who would, let's just give an example, see, let's say, a 12-year-old out on the street with no parental supervision, maybe has dropped out of school or is not going to school. And then, of course, I think about during this pandemic where they're not in school and a lot of kids are not participating in the online learning situation for many reasons. So the trafficker would come in and capitalize on that vulnerability and entice them they're not necessarily physically grabbed and thrown into the back of a truck. They're enticed to do something, and then they feel beholden and they can't get out of it. Is that right? Like sort of a net.
Exactly. And it's same with child physical and or child sexual abuse. There's a grooming process. So the traffickers will spend a lot of time getting that victim to trust them before they begin their traumatization.
So is this just the same thing as kind of like what you would say a pimp and a prostitute would be? I mean, is it now just become human trafficking?
Exactly. So prostitution, although prostitution not always is considered human trafficking, but if there is a pimp or a trafficker that is exerting any kind of force, fraud, or coercion, then that is considered human trafficking, and that is not prostitution.
So I would think this would be a hard cycle to break for the victim. Things would have to get pretty bad for them to be able to reach out to you. Is that right? Or are you putting the outreach out and just trying to see who might be a victim and just giving them the opportunity to come forward, and it doesn't always happen right away?
Yes, that's true. A lot of victims do not disclose, unfortunately. So our goal is to just let victims know that there is help available and that we're always here for them. And our goal when a patient comes in is not to get a disclosure from the victim. We just want to be able to provide services to them and let them know what we can offer to help them out.
Are there times when you have to walk the line between helping them and are you obligated to call the police, or can you just help them from your end and not cross over into the legal end if they don't want it?
That is a great question. For adults, we are not mandated to report to the police unless they disclose any kind of trafficking in childhood. So if you have an adult that is, say, 20 years old and they report human trafficking, we cannot report that to the police unless they said it started when I was 17, for instance. So they do have that protection to where we can remain confidential when they come in for help. And I think that's really important for victims to know, because a lot of victims don't want to disclose because they're afraid that we will report without their consent. And sometimes reporting without consent can put the victims in much more danger. And it could also break down that trust barrier, the trust between healthcare providers and patients. So if a healthcare provider reports something behind the patient's back without their consent, they're going to be less likely to report to another healthcare provider in the future. The difference is with minors, that is considered child abuse. So those reports would have to be reported to the Department of Social Services and our law enforcement partners.
Ashley, I would imagine that when SAFE first started, it was primarily a sexual assault unit. It broadened its horizons based on what was happening. And so you went into the area of human trafficking. I would imagine you've had to learn so much about what it is and the prevalence of it, not only in Maryland, but across the country.
Exactly. So like a lot of things with our program, the SAFE program, they evolve over time. So when I first started in the SAFE program in 2014, we didn't have human trafficking protocols or policies, and I didn't have any training about human trafficking until I had 2 young females in the emergency room that were victims of human trafficking, and I really didn't know what to do, and I realized that that was not okay. So we really started working on filling that gap here at the hospital and ensuring that all patients that come in are treated appropriately with trauma-informed approach, and that they were given the resources that they needed. So we really worked very hard on our anti-trafficking initiative to ensure that all healthcare providers are going to be trained to recognize the signs and to know what to do in that situation when it presents itself.
Yeah, I guess it's one thing to treat the actual assault or treat the abuse, but if you don't treat the bigger issue, it'll just keep happening.
Exactly. Mm-hmm.
When human trafficking, when you explain to people, do you think most people understand what it is? It's a weird name, don't you think?
It is. I feel like a lot of people don't understand it because of the things that they experience or they've seen in the media. So when you think about different movies or television shows, they usually show victims as being in the back of a truck or chained up, and we usually don't see victims present in that manner. So once they learn a little bit more about what exactly human trafficking is, they're pretty surprised.
How can you recognize it? What are some of the signs?
So there's
that an average person may I don't know, notice?
So unfortunately, there's no real profile to a victim. It could be anyone. It could look like me or you. So some signs that you might see that are common for victims are that they are fearful of someone that they're with. Maybe they have a controlling romantic partner or a controlling individual in their life. They might be just extremely afraid. There's a lot of different signs such as that.
And what if you do suspect it? What should you do as just, a bystander?
So if you suspect human trafficking and there's an emergency situation, obviously the most important thing to do is call 911. We never want to approach a suspected trafficker because these situations can be extremely dangerous. If you do talk to a victim or a suspected victim, you always want to talk to them alone, always alone, not even with a friend or someone that appears to be concerned about their well-being. You want to offer them help, let them know that you're not judging their situation, and you want to let them know who they can call and what kind of things they can do to stay safe. And one of the most important numbers to remember is the National Human Trafficking Hotline. That number is 888-3737-888, and that is available 24/7. It's confidential. Anyone can call this number, including the victims, and we can also report tips using this number.
How has this pandemic changed your life, and what do you think the fallout will be for your people, your victims, your people who may come forward?
So unfortunately, I feel that this pandemic has put victims at a huge disadvantage. There's a lot more vulnerabilities, especially with the economic crisis that we're having. People aren't able to go to their jobs and make money and care for their families. Some people are not able to pay their rent. And sometimes, if in situations like this, traffickers will target those that are vulnerable. So it might be a landlord that says, you can't pay your rent, I'm going to evict you if you don't do X for me. So things like that can definitely affect. Also, the amount of minors that are out of school across the country, we're spending a lot more time online, and predators will use online chat functions or social media or gaming chat functions to try to recruit younger populations.
Oh, Ashley, that is a great point. I don't know why I didn't even think of it, but you're right. So many kids are online all the time, every day now, and parents are letting them because parents have to work and do what they have to do as well. So you think that there'll be an uptick sort of in that? Predators will be taking advantage of that.
I do. Yes, I do believe that. So the most important thing for parents to do is have an open dialogue with your children and let them know, the internet is not always a nice place, and never to exchange personal information. Only chat or talk with people that you know in real life. There's a lot of safety tips that parents should be talking to their children about when they're online. Even the younger populations. There's a lot of children who have iPads who are 6, 7, 8 years old, and us as parents, we need to be
younger,
and we need to know what they have access to online. Even if it seems like a very harmless game, there might be a chat function on that game that predators can use to try to get in contact with our children.
I feel like you guys in the SAFE unit, where you might not be on the front lines today handling cases of COVID-19, your front lines may need to be fortified weeks, months, and years from now when the fallout really starts to happen. Is that your sense as well?
Oh, yes, I do.
You're gonna
I agree.
Yeah. All right. And how are you doing, your family and everything? How are you coping with all of this?
We are doing well, thank you. I hope the same for yours. We're just really taking this time to practice some self-care.
Okay, always important. Thank you so much. Ashley Macri, we really appreciate you joining us and talking about human trafficking, how it could be happening, right under our noses. We don't even realize it, but to be aware, don't approach the trafficker if you think it is happening. And we have numbers that we will continue to bring you and show you what you can do. And there they are again. So if you happen to see a situation where it doesn't look right, you can kind of tell it doesn't look right, just call anyway. It can't hurt. And the number is right there on your screen. It is the National Human Trafficking Hotline, 1-888-373-7888. Again, that is staffed 24/7, and it's not only someone who may see a situation, but it can also be for a victim. A victim can call SAFE. I think anytime you reach out, someone's going to put you in touch with the person who's going to help you best. And there is also the SAFE number. We want to make sure we get that number out. 443-849-3323. Again, that is staffed 24/7. And the emergency department has a phone number. A lot of people who are victims of sexual assault or sexual abuse will go to the emergency department, except during this time. This is a time during the pandemic, during the lockdown, that people are not necessarily comfortable going right to the hospital. They worry about getting sick. They worry about a whole host of other issues besides what they're dealing with. So sometimes the phone is really your lifeline, and that's the number to call, and people can come to you.